Welcome back to the studio. I'm Andrea Sanke. Now let's get to the core of our 2020 forum and to our first panel discussion. Now, over the next 90 minutes, we will explore how the media shaped the narrative during the pandemic. Now, many have called 2020 the year of the infodemic, where all forms of media disseminated both life-saving information as well as misinformation and even disinformation regarding the novel coronavirus. Many also noted how the pandemic was politicized. We witnessed certain Western countries, Western leaders, namely the United States, for example, first congratulate China for its coronavirus management, only to turn and blame China outright for deliberately hiding crucial information that put the world at risk. Every medical conclusion, data on cases and deaths, as well as every accusation against politicians and even doctors and health workers were also taken up on social media, which sometimes spread unsubstantiated claims and lies, really, as well as manipulation. So let's begin our panel discussion now. Infodemic, how the international media impacted the pandemic, with media leaders from various corners of the globe. Starting from Turkey, we have İbrahim Eren, Chairman and Director General of the TRT Network. Representing European broadcasters, Noel Curran, Director General of the European Broadcasting Union. From Asia, Mottaghi is the Secretary General of the Asia Pacific Broadcasting Union. From Africa, Gregoire Ndjaka is the CEO of the African Union of Broadcasting. And finally, from Italy, Marcello Foa, President of Italy's public broadcaster, the RAI Television and Radio Network. Thanks all so much for being with us. Marcello, I introduced you last, so I will begin with you. You're in Italy, the country, of course, that became the first epicenter outside of China to genuinely come under attack from this virus. Tell us first how your coverage evolved as a public broadcaster and when you realized how much the information you disseminated meant to your fellow Italians as well as to the rest of the world.
Well, this was a very challenging moment in early March, because our way of producing news, producing entertainment, producing culture, and also supporting the government, which requested RAI to produce new programs for schools, for example, educational programs. And what was very good is that our structure, despite the fact that we are a big company with 13,000 employees, reacted very rapidly. And so we were able to realize some major changes, keeping all our TV channels alive, so we didn't have to close any TV channel, but of course we were obliged to cancel some shows live because it was impossible to have the public in our studios, but we were able to provide what we should say it's a sound information 24 hours a day in all our channels. We were able to create very rapidly a sort of internal commission with some scientists, medicals, and journalists here in Rome that were able to exchange news, to check the news about the virus that would have been broadcasted. So we were very open and very precise on checking the news we were giving to our public, and then we created, for example, so this was a very challenging moment, very positive, and also we were able to create new channels in our digital platforms with excellent results. Overall, we saw that even the younger public that usually doesn't look TV or doesn't see RAI as a sort of very fashionable brand for them, it became to be a very, we established a very lasting relations with them. So overall, it was excellent results at the end of the day.
Right. Congratulations on that. I mean, and you were up against something else rather specific because, again, Italy was really the first European country, Western nation, to get hit as hard as the pandemic could possibly hit. And in Italy, there was a joke, that people didn't die from coronavirus, they died with coronavirus. So you knew there was a lot of public skepticism. How did that shape your coverage?
Well, we were severely affected by CNN showing this horrible chart saying that the virus spread from Italy around the world. This was such a damage for Italy, unbelievable. And this was totally a fake news. We reacted, we said, okay, we stay on our course and we show the Italian government and the Italian public TV show that it's not true. And in fact, when the other countries were affected severely by the coronavirus, even more severely than Italy, everybody realized that what had been spread by CNN was totally wrong. And what we saw that keeping a serious attitude was the best way instead of challenging, starting polemics on a daily basis. And we think that this serious attitude was a good one, and therefore we at the end of the day we realized that also the perception of Italy changed, and so from skepticism or critical attitude from the international community, we arrived with sort of good positive image, because also good friends in Europe realized that Italian did take some severe measures that were effective. So at the end, we were on a positive image track.
Really interesting to get your perspective from Italy, especially in the early stages of the pandemic. Let me turn to İbrahim Eren as the director of Turkey's public broadcaster. Did you follow any, sort of lead from other channels whose countries were hit first? I mean, like Rai. And tell us what steps you took to ensure that you would keep people informed, accurately and safely without causing panic.
Surely the pandemic has disrupted people's health systems, and also it affected the media organizations in many ways. And in my capacity as the DG of the TRT, we try to adopt a multi-layer approach, which consists of the first one is securing our most important assets, namely our journalists and staff. And so for your question, to make news to provide accurate and timely information and discrediting fake news. The first one is make sure that our journalists and staff are secure. And so we set up news operations in their living rooms, as you know, and our correspondents in the field took extreme precautions to keep themselves and their colleagues safe. And also we try to continue to attract our audiences through quality and innovation communication practices. Yes, news are important, but they were in their homes and they were doing nothing in their homes. So we made a motto through engaging formats. Home is full of life. So we change all of our schedule in our main entertainment channel in the daytime. And we just focus on the more healthy issues and sports and diet and those kind of issues that you are going to face when you stay at home. And about the fake news, one of the biggest issues and challenges were media coverage, as you said. And even the if you remember, United Nations General Secretary Antonio Guterres said our common enemy is COVID-19, but our enemy is also an infodemic and of misinformation. But what I have seen in this period was the audiences were really keen into tuning into the public service news sources. And we gave accurate information from the first sources, from the doctors and ministers, Minister of Health, so that people tune into the public service media to get enough information. As you may remember, it's almost 1 year now. The first days were like people were talking about there is no coronavirus, there is no nothing like that. Don't believe in the coronavirus, that kind of stuff. And also people were refusing to use any of the medicines they have. So we tried to give the hospitals, and we made a documentary about the hospitals, that how the doctors are trying to fight against coronaviruses. So we tried to create an empathy for the doctors, that there's a virus and they are fighting against it. So we both supported the hospitals, the doctors, and the for spreading the good news in Turkey.
Right.
And also the last thing was which was in our multi-layered approach, was to continue to develop our digital to keep youth engaged, because the youth, the young people, they are the ones who are not much affected, but also they are very risky for the elder ones, and we need to engage them with our news and the programming. So we really invested our digital programming rather than linear programming for the youth and the young people. So this was the first reactions we gave to the coronavirus, Andrea.
Okay. Thank you for that. I'd like to switch our focus now to Asia. Javed Mottaghi, this all started really in Asia. So I want to hear your experience working in particular with the country where the outbreak started. And tell us if you felt you were actually getting the information you needed out of China, and was there honesty and transparency there, and how did you act on it?
Well, thank you very much. As others said, that COVID-19 changed the way we work, the way we live. But it didn't change the responsibility of broadcaster. Broadcaster remains responsible to broadcast accurate news and information, entertain people, inform people. And for that, we at the ABU had another challenge, because we are a union with 270 members across the globe, different time zones, and members are working from home. Most of them are MCO, and we at the Secretariat should fulfill the wishes of members, at the same time should get information from members and disseminate to the public and also to other broadcasters. What we did is we enhanced and expand our news exchange network that we usually do. We have a project, Asia Vision News, which we broadcast some 17,000, 18,000 news stories per year. And we get onto that, and we within the 2020, 7,000 news stories about COVID-19 was disseminated through Asia Vision. And we got this news information from 34 countries in Asia, including China, that you said. Actually, China was the first country who started contributing to the Asia Vision, as well as others. And we also had partnership with other sister unions, getting news with other sister unions, getting news from Africa, from Europe, from the Arab countries. This Asia Vision enabled us to disseminate massive information, accurate information, say the storytelling from the broadcasters are directly to the public, as big as over 3 billion audience that we have in ABU. So this was, in a way, changing the challenges to opportunities. These are challenges that we're all facing, but you have to find a way forward. It was a solidarity content exchange network in response to COVID-19. And this was launched in April 2020. And this was a network, a content exchange network, enabling broadcasters to contribute to that. And then we disseminate the information to all countries in the region. You might be surprised to hear that 1,100 copyright-free program content from 36 countries we received and distributed to the countries across the globe. And I have to say that in this process of dissemination of news, not only China, but also other countries affected in the region like India, like Turkey, Iran, and etc., they all contributed. And the practically Asia Vision became a network for for exchange of ideas, exchange of experience, and how to tackle things together.
Okay. Javed, I'm wondering, though, if I can get your sentiments on what you heard Marcello say, that he felt all Italian broadcasters were up against the messaging, particularly of the biggest international broadcaster, arguably second to BBC, maybe, the CNN, and how the information that they were disseminating seemed to manage to take priority over a lot of Italian media. It confused the public. It made Italians feel like they were battling, Italians in broadcasting feel like they had to battle elements of fake news coming out of a giant broadcaster. Did you find that in Asia, that your broadcasters were competing with the big players?
Well, competitions exist everywhere. And everywhere, every country has right to disseminate information. But when we look at the news, and fake news is there, naturally fake news is not a new phenomenon, it has been there. But the fact is, it's the role of public service broadcasters to tackle that, to become a reference point and to tell the story to the public, what is fake and what is not fake. And this is a task for public broadcasters to become the reference point when it comes to when audience receives massive information from everywhere in the world. And naturally, in Asia, some broadcasters may like to disseminate more information about whatever they have. And it is up to the public broadcasters in receiving countries to assess, to check, and to see which one has to be disseminated to the public. And in this respect, I think ABU did a good job, because we also were in a position to invite CEOs and senior broadcasters to talk, because when you talk together, you create an atmosphere for dialogue, and that helps you to have a better understanding. And we did not leave Europe out, actually. We invited RAI is a good contributor through the EBU, and we invite all of them to contribute to this, as I said, service that we offer to members. And we believe that Asia has its say. And I don't agree that it's dominated by the so-called international media, mainstream media.
Good to hear. Let me turn to Africa then. Gregoire and Ndjaka, I'd like you to help us understand what African broadcasters were up against here in trying to disseminate, accurate information and helping mostly people understand the need to halt entire economies where millions of people are surviving only on daily wages.
Okay, thank you. I would like to say that in Africa, the situation was very, very difficult. And the most preoccupying things in Africa was a psychological one. At the beginning of the coronavirus, we faced a big challenge. It was the challenge of fake news. How could we fight fake news? The first news which they brought up was that a black man cannot die of. This news came in Africa. Everybody said, okay, we cannot die of coronavirus. We can continue our daily life. We had to fight against that. The second one was that, and this came even from the World Health Organization. The Director General made a statement which brought a lot of confusion in Africa. He said that when the coronavirus will reach Africa, it will be African will die because our health system is not good and so on. So psychologically, we were marked by that. We were marked by this preoccupation. But at the end of the day, as you can see, what he said was not exactly what happened. The other fake news we received in Africa was that consuming and spraying alcohol all over, as well as being exposed to strong sunlight, will protect you from virus, which is not also a fake news. And we also receive another fake news is that the coronavirus is only for the old people. So our fight was to help our members to educate people to face coronavirus, but also to fight against fake news. So we did a lot. We had a lot of experience here with our sisters organization, in particular EBU and ABU, where we receive a lot of information from them that we also brought to our members. And I would like to thank the Director General of, because they brought a lot of useful information for us. So we took note that the best way in Africa to fight against all these fake news was to listen to public media, public state media. That's what we did. And we organized for the first time in Africa, we brought together more than 300 artists in a live program, on a live show. And this show was broadcast many times in our members' country. And some of our sisters organization took that also. And we developed with our members also the educative program. You know, in Africa, we have a particular situation. We don't have electricity in all the territories. There are territories where there's no electricity, but we have to use media to inform people, to try to help our members, to face these situations. So we were trying to make it so that where it's possible, we can send the information we are receiving from our member sisters to our members organization, so that they should educate people. And I can say that today,
Right.
all our members have educative programs. That all of them have educative program. This we took it from our sisters organization union, and we implemented that in our countries. So in Africa, since up to today, the biggest battle is the battle of fake news. For instance, now they say if you have contacted coronavirus, you have immunity for all your life, which is not true. So we have
Right.
to fight on the daily basis to help our members and to help the population to face the spread of coronavirus. Thank you.
Right. Gregoire, thank you for that. Let me turn to Noel Curran now. And I want to pick up on this because we keep hearing the phrase fake news repeated here. But to be fair, that perhaps unfairly puts the blame on journalists and news channels for reporting news irresponsibly, when the truth was, over the course of this pandemic, doctors and scientists were learning as we went along. In the case of Africa that Gregoire brought up, when they said it was going to be an absolute disaster, they didn't quite understand how the coronavirus was affected by weather, for example. Later, they determined, because of the climates of certain African countries, it made it more difficult for the virus to spread. So as scientists and doctors were learning more about exactly how the virus behaved and how dangerous the pandemic would actually be, how did you manage the coverage in Europe, which was most detrimentally affected, especially over the winter months?
Thanks, Andrea. Good to join you. I think this is very complicated. The issue of misinformation, disinformation. Some of it is straightforward. The kind of lies that you broadcast elsewhere. Quite a lot deliberate, quite a lot on an unprecedented scale, and actually quite a lot of it quite sinister and dangerous, around possible cures, about things that you would do and take, as Gregoire has just said, to stop you getting the virus. And in a way that was more straightforward, but was so large, the volume of it was unprecedented, that it was difficult to deal with. And I think the platforms made a better effort than they have done previously, but still fell short. And I think that raises a whole series of other questions. There was also misinformation. Senior political figures around the world were saying things that no scientists believed, and that spread. Certain celebrities, through their social media campaign, when they have a lot of influence because of their own perspectives, also spread information that was incorrect. So it was quite multifaceted. And then the point you make, and it's an important point, is people talk about the politicians versus the scientists, or the people of misinformation versus the scientists. The scientists didn't agree. The scientists still don't agree. Different countries took a different approach based on approach in Europe, other countries. So there wasn't a single science here. There was a single science on a lot of it, on a lot of the issues, and still is, but there wasn't on everything. And then that became difficult. I think in terms of the second part of your question, Andrea, as to how we handled it, we in the EBU, we set up content exchanges, news operation went into overdrive. We did lives, we did content appeals, we did webinars, but a lot of the really important stuff around this was in exchange. Every Friday, the editors-in-chief in all of the major broadcasters in Europe met, organized through the EBU, and they talked about these issues, and they talked about what they were struggling with and what they weren't. I joined several of those meetings, and they were very open conversations. Right at the start, the editor-in-chief from RAI had a massive influence on European coverage by articulating the scale of what Italy was facing and the day-to-day of what they were facing. So I think it was a multifaceted approach. We have had fact-checking operations all around Europe. We've been exchanging information. Complicated, unprecedented. I believe public service media, and everyone here I think has had the same experience, has stepped up. The public have responded. Trust levels are unprecedented in terms of the response the public have had to our output, and audiences have increased, both in digital and linear. So I think that's a testament to the work that was done by journalists and others in public service media around Europe and the world.
Right. Noel, let me just stick with you for a second, and I'd actually like to have all of our panelists comment on this question, because so much of the reporting from the onset has been and continues to be the numbers. We're constantly being bombarded with case numbers, with the infection rates that can sometimes sound very alarming, but when they're not placed in a per capita context, they can also be misleading. Ibrahim Eren had mentioned that TRT was trying to talk a little bit more about the experience of the doctors in all this, when you actually would really see how people are affected by the virus rather than constantly reporting the case numbers somewhat out of context. So Noel, let me start with you. Did you feel that tended in part to be somewhat misleading by constantly reporting the number of infections rather than looking at per capita numbers and the actual danger, the people that were desperately and dangerously infected and were actually sick?
Yeah, I think the numbers issue is just, again, it is incredibly complicated. And I'll give you my own personal view on it. You know, as a former journalist and editor at Current Affairs, we weren't sure what we were dealing with. We weren't sure. We were grappling with incubation periods, with how many percentage of people would end up in intensive care, all of this. So the case numbers became critical, and particularly in countries where the cases were rising exponentially. My own personal view is that as time went on, we didn't nuance those numbers enough. And I mean the media generally. We didn't concentrate enough on hospital bed occupation and capacity. We didn't, when we were doing comparisons between countries, I think it was harder to find the per capita comparison. And if also we didn't compare some of the figures to other viruses and other illnesses. And then on top of that, we don't have figures for how many people are going to die of cancer because they didn't get a checkup. Those figures aren't available, but we know that people are going to die of other illnesses because of lockdowns and the virus. So I think it's understandable how we concentrate on the figure. I do believe that as things went on, though, Andrea, I think it did become more nuanced. I think there was more per capita comparisons. I followed European coverage. I followed our members' coverage, and we talked about this at the editors-in-chief, the need to move beyond the absolute number. And I think as things went on, there has been a lot more coverage around that. But again, it comes back to the science and what is capacity, what is too much, where, at what point does your health system collapse, and that varies by country and is sometimes impossible to actually put a number on or to gauge. So I think we improved a lot. I think we've realized that the numbers are complicated. I think there's still an emphasis on the core number somewhere, but probably much less so than there was 6 months ago.
Okay, let me ask Marcello, the same question. Was it fair to report, the numbers as they were reported? Because actually, at the beginning, it put the heat on Italy, maybe fairly so, because per capita numbers in Italy were pretty bad at the onset. But later, when we saw, and we still see, the news reporting that the United States, for example, and India, for example, have some of the highest rates in the world, Brazil as well, but they also have some of the biggest populations in the world, it can feel misleading.
Yes, I agree. Thank you, Andrea. I agree with Noel. I guess the problem is that at the beginning we were all under shock. We couldn't understand what was going on. So Prime Johnson saying, "Oh, basically this is nonsense to lock down everything," with other experiences that have been dramatic. What we see now is that we feel now the public opinion wants to have reliable figures. And also I would say that at a certain point we must send a different message, because if we see the numbers, we see, for example, the death rate in Italy is zero, let me say, it's less than 1%. Overall, so it's a very, very marginal death rate. And on the other hand, we see that the numbers of people that
what is the death rate in Italy? Out of curiosity, you said 0.0 what?
0.06.
Is it far less than 1%?
Well, yes, it's far less than 0.1%. No. It's 0.06. So it's less than 0.1 to overall the population.
Gotcha. Yeah.
So if you see these rates, you said, are we exaggerating? Are we exaggerating? The problem is, as Noel said, that we risk that the health system collapses. But on the other hand, we see now that economic drama going on. People now here in Italy feel upset, worried. There were some headlines today in newspapers saying that there are 5 million new poor people in Italy. So it's 5 million people in just a few months. It's a lot. And so what we see is that now what is really appreciated by public opinion, by our listeners, is that we want a fair, balanced responsible information spread through our channel. We feel the need to help the country to recover in a responsible way. And also, if we keep saying just numbers about the numbers of people that are in hospital today, we tend to reiterate panic and pessimism, and this is a social tragedy. So I guess now the new challenge is how can we balance between giving a reliable information on a daily basis with the need to recover our society, our economic system. This is crucial. Otherwise, we will have hundreds of thousands of people dying from other causes than the COVID-19.
Right. Indeed. Ibrahim, Eren, let me ask you, if you think Turkey and the Turkish media kind of got the balance right. I mean, we see how Turks have decided policy rather differently than a number of European countries. I mean, the borders were reopened in the summer. Travelers were allowed to come in from the UK and Russia, for example, but case numbers stayed much lower than in the spring months when the pandemic was at its peak. But now we're seeing those numbers come back. Still, when you watch Turkish broadcasters, they always reported not just the numbers of infections, but the deaths and the number of those recovered.
Yeah, in general, I think that the media coverage in Turkey was fair. But the interesting point is, Andrea, when you look at the world, there was an appetite for a doomsday. For people were like waiting either from the movies for the last years, I don't know. People were waiting like a third world war in viruses. So as Marcello said in the first days when we were in shock, we were people were expecting in a psychological way a very bad situation in all over the world. I think worse than now. And there wasn't, in terms of numbers, we are from your first question. In terms of numbers, even the media, the linear media, the conventional ones, they like to give numbers every day. So it is also a very psychological aspect to it. I believe it came from Asia, from China, Wuhan. There were rumors that it came from a lab. So and the humanity, the generation issues. So it was very interesting in the first days. The reactions were more psychological rather than factual. I think this was one of the reasons, because on numbers, I believe that we were very keen on. The media had an appetite to give numbers, but now it's almost 1 year now. So I think there are very patterns in every country how to give the numbers, the death rates, the ones who has hospitalized, and who are recovered. So that kind of patterns, even if it is different in some countries, in Turkey it's almost the same for the last 10 months, I guess. So I think it is, generally speaking, it is fair in conventional media. And speaking from the conventional ones, the TV stations, I think from the day one, the TV channels, who has a history and culture of broadcasting for many years, who has a culture of journalism, a legacy of journalistic skills, gave more accurate information than any other new age digital platforms, I believe.
Okay. Javad, let me get your sentiments here, because, you know, Asia, India in particular, was such an interesting case when it comes down to the numbers. We, in the media, kept saying, you know, India has one of the highest caseloads in the world, always in the top 3, but India also has the biggest population in the world, next to China, with 1.2 billion people. So when you broke down the per capita numbers, India didn't look so bad. Do you think it was fair how the pandemic was being reflected in countries like India, and did it serve the country well?
when you look at the numbers, you have a different perspective, and you don't look at don't look at the population of the country, like 1.3 billion in India. And it was very complicated at the beginning because not only from our region, also we got misleading information from France, Spain, Italy, looking at everybody's looking at the numbers, whereas later on, we have seen that media is looking at the number of people who recovered, also looking at the number of people who has been actually able to recover. And in terms of population, we do have this. We did have this in India. We had this in Indonesia with 260 million population. We do have this in other countries like Thailand and Vietnam and all that. But we have seen later this form of corrections. I also would like to add that we have seen different response from the policymakers, politicians. For instance, in Vietnam, we have seen politicians who took clear action from the beginning of this pandemic to control the pandemic. And if you look at the situation in Vietnam, they have done far better than many countries in the world. Just like New Zealand, they have done far good job compared to others. But as you said, when you look at the populated countries, the situation is different, and you have to always look at the number of people who get infected compare to the total population of the countries. But we also saw that some politicians simply ignored at the beginning, including some of the politicians in big Western countries, and they have been badly affected in terms of number of infected people and number of people who lost their lives.
Right. You brought up something interesting that I wanted to ask you about, actually, because since you represent so many broadcasters in so many different countries, I mean, the dynamics between different Asian countries it was just remarkable, because you had countries like South Korea, for example, and Vietnam, as you mentioned, that were some of the best in the world at controlling the pandemic, next to other South Asian and Asian countries that the media was saying were having the most difficult time trying to fight this. Do you think the dichotomy that was illustrated in the international media was fair? Was it accurate?
Definitely not, actually. Definitely, what we have seen is that good examples were not reflected as it has to be, and positive improvement were not reflected as it has to be. And mainly we saw negative news. Mainly we saw that talking about the number of infected people in India, in Indonesia, Thailand, but they didn't talk about the methodology of reacting towards this in Vietnam. In Korea, you can see Japan, and you can see how best they were able to contain the virus and get the number of people died very, very minimum. If you look at I was talking to Vietnam a few weeks ago, and even for the first few months, there was no death in Vietnam. And it was important for me to see why that happens. And I noticed that from the very beginning, their government actually came with strict regulation how to contact other peoples and protect people's life. And unfortunately, these good things that we saw in Asia have not been reflected in the mainstream media across the globe. I can see that this happened from Africa also, because as Gregoire said, that a lot of fake news were disseminated in Africa, the same as Asia. But there are many lessons, Andrea, that we learned from Asian countries who did very well: Japan, Korea, Singapore, Malaysia, and New Zealand, Vietnam. A number of good examples we have that they did good job.
Right. Gregoire, I'd also like to get your take on what you alluded to this in your first answer as well, but the issue with reporting the numbers. and especially how it did affect the African context, the African continent rather, especially when those numbers were taken kind of out of context. And then you realized actually how few Africans were being affected by coronavirus, affected and infected with coronavirus. You had a much bigger problem with malaria, and it's being said now actually by the WHO that more people were allowed to die of malaria because they weren't able to get the basic resources that they needed because of the coronavirus pandemic restrictions. So talk to us about that, how you managed in broadcasting to try and disseminate the actual numbers fairly and to not mislead the public into thinking that perhaps there was more difficulty than there actually was.
Thank you, Andrea. I would like to say that in Africa, the figures which are coming from abroad, from foreign countries, are always very, very disturbing. But if you take the case of Africa, I want to quote two countries, Cameroon. In Cameroon, between March and the 1st of March to the 30th of November, 22,170 people were had coronavirus, and we had 437 people who died from coronavirus between 9 months. 437 people. In Senegal, for instance, we had 15,627 persons in 9 months. That is from the 1st of March to the 30th of November, that's yesterday. And we had 333 people who died from that. Believe me, this is nothing if you compare it. It's something, but it is nothing if you compare it with the effect of malaria in the countries. You will see that for a month, only a month, you have more than 500 persons dying in one town, like Yaoundé or Douala, from malaria. And if you go in the villages, you will see that the number of people who are dying from malaria is much more important. And journalists and a lot of intellectuals started asking themselves in Africa, is it useful for us to concentrate on coronavirus? Is coronavirus something concerning Africa even, when we have just near us malaria, which is killing people? We have tuberculosis, things like that, where people are dying, and they are dying in a great number. So what, as a union, we are trying to do is to show that everywhere where somebody is dying, it's very important to concentrate it. That's why we continue to help our members to organize the fight against coronavirus. And I want to tell you, in a country like Cameroon that I know very well, there was even a debate where people and journalists were saying that the number of 437 is not correct, that there are less people who died than that, and that the government is bringing this number to show to international community that yes, coronavirus is there. So there is a big problem of number in our countries, and what we believe as union is that everywhere, as I said, where people are dying, we have to concentrate there and bring our contribution. That's why we are continue to give to our members all the material we are receiving from our unions, so that they should continue to face the coronavirus. So in a nutshell,
Okay.
what I wanted to say is that the problem of number of counting the people who are dying for coronavirus is very, very delicate in Africa. If you base your argument or you base your duty on the fact that you will look for the number, people will tell you, okay, that number is good, but the number of malaria is greater than that.
Right.
So it's very, very delicate.
So Gregoire, let me just ask you a pointed question then. Looking back now, were the lockdowns, with all of their consequences, both economic, psychological, and of course, for the people that were robbed of certain medical services that they needed arguably more than anyone infected with coronavirus in many African countries, were the lockdowns worth it?
Yes, I think the lockdown was very important. As I said, everywhere where there is this damage of coronavirus, governments are obliged to take measures to stop it. And I think even that's my personal point of view, is that one of the reasons why we don't have the spread of the virus is that in some countries, if you take a country like Senegal, the government took very, very good, yes, good decision to face this problem. There was a lockdown. You could not go from a town to another one, and so I think those are the reason why the number is not too high. So for me, those decisions were very good, and we have to continue in applying the decision, the distanciation, and so on. You know, the culture, the African culture is the culture of contact. We have a lot of contact, and with these measures, we started. The government helped people to stop this contact and to fight against coronavirus.
Okay. Marcello, I'd like to kind of get your hindsight now on in spite of all what you called, fake news, some of the panic, arguably, that you think may have been created, did it ultimately serve the better purpose? The media coverage for coronavirus, particularly in Italy, did it save lives and protect people?
In one way, yes. On the other way, no, because what Gregoire was saying, it's very useful also for us. I mean, we don't have malaria, we don't have those kind of illness that are dramatic. But what we see here is that cardiologists and doctors are saying that we will see in the next months a dramatic increase of numbers of people dying for cancer and heart problems. Because some people don't go to the doctor, to the hospitals, because they are scared to be infected with the virus. So they prefer to delay controls, and which is dramatic because a lot of them will die. And the Cardiologist Association just a few days ago made a statement that they believe that the numbers of people that will die for health problems will be very high, dramatically high. So what we need now is that we should teach to the people or make them aware that they don't have to avoid their general health because of the fear of coronavirus. I have, for example, a friend that had broken his leg, and he waited 3 days before going to the hospital because he was scared of the virus, which is make nonsense. This is an educated, person. So this is the crucial part and the hidden part of the history. We must now teach the people that the situation. Sorry, please, Andrea.
No, I'm sorry. So I was going to say, if you could go back, is that how you would recraft or change your messaging via RISE platforms, is to make sure that people understand that they do need to take care of other health issues that will come back to arguably haunt the country?
Yes, I mean, if I could go back, I would do this, but this is I don't think it's useless. It's useless. What we should know is, first of all, what we have to do now, and how we should react in case there is another crisis like the COVID-19 crisis. So I prefer to learn the lessons for the future instead of thinking what I could have done different in the past.
Okay, but hindsight is 2020, and that's where we do extract those lessons from.
Okay,
what lessons
okay.
do you think you did learn?
Me? Still me? Yeah. Well, the lessons that I've learned is that overall there has been a dramatic lack of our health system, which was not prepared to tackle those kind of crises. And this was, I guess, a big failure for everybody, for the governments, for our society. And this, of course, this is a major lesson. On the other hand, I think that what we have to do as journalists, I'm also a journalist, a former journalist myself, is that we must be very strong on balancing what is the emotion of the moment with a responsible, analytic, wise way of reporting. And I guess that what people think and expect from us is reliable information, which is also sound information, which is also the way of balancing from different views. What Javadi was saying at the beginning, also Gregoire, that the experts themselves were wrong. I mean, they were spreading some news that, look, at the beginning they said that masks were useless, and then the masks were mandatory. They said that Africa was under threat, and then they changed their mind. Also, they have been not responsible. So I guess that in our duty is avoiding all kind of extreme journalism, but a challenging, responsible journalism is what we need. I mean, if the World Health Organization spread or communicate in an inappropriate way, we should challenge them and saying, what are you saying to us? Can we trust you? Not to destroy the organization, but to provide sound information to our public. And to find the right balance between those two, it's really difficult. But this, I guess, we must think about it. This is crucial for the credibility of the public service media.
I agree. It takes a lot of critical thinking. And I'm going to tell you, Marcello, I mean, I asked that question about what you've learned, what we've all learned, reminding everyone that this is not over. And for those of us in the Northern Hemisphere, we've been told that this could possibly get a lot worse before it gets better. So Noel, let me ask you, what have you learned? If hindsight is 2020, is there anything you would have fundamentally changed about how broadcasters behaved and what information they disseminated, what critical questions they didn't potentially ask, and what you might do different now going into this European winter?
Yeah, I think from a purely EBU perspective, we learned that we can work together and our members can work together as an organization with a common goal. And it's been a really satisfying year for us in that regard. In terms of the way people responded. I think in terms of the lessons for general media is, I think public service media did save lives, Andrea. I think overall, I think the virus is not strong in some countries, but 1.5 million people have died from it. So, and also there was a time when it was growing exponentially, and it is again in some countries. And I think the public information that was disseminated around social distancing, the campaigns that public service media got behind around knowledge and information of the virus and contracting it, around a whole range of different things, I do think were very important, because hospital systems in some countries were in danger of being overrun, and we saw what happened in parts of some countries when that happened, and it was pretty scary. I think the lessons, though, are that, for me, the main lesson is this is incredibly complex. There is no one science. There's one science on some elements of this, but very prestigious, renowned people fundamentally disagree on other elements of this. I think the numbers are misleading. The number of cases depends on population. It also depends on testing. And then, as we've said, there are numbers that are missing here, which is, what is the long-term economic effect? How many people died of other illnesses during this period? And we won't know that for a long time. So I think the complexity around this is a lesson for all of us. When it started, it looked, and I can't remember, one of my colleagues here has said it, maybe Ibrahim or someone, when it started, it just looked much more straightforward. big virus killing lots of people. Here it comes, you know, and then it just became very complex, and different countries had different experiences, different nationalities, different races in America. So I think that's the main lesson is this is a very, very complex pandemic. We're not through it yet. Hopefully, the vaccination process will give us some respite next year. But for me, I think I learned the power of public service media when we work together, the absolute influence we have and trust we have with the public. And I learned that things like this are very, very complicated, and you need to pull at them, hear different voices, question, not aggressively, but just question and get a range of opinions, particularly early on.
Right. Javad, let me get your perspective then from Asia. First of all, can you speak to lessons learned from the past season and now that we are going into the winter season again in the Northern Hemisphere? Is there anything you will change now in your broadcasting approach, learning what you've learned, or are you on the same page as Noel that it's extremely complex and a lot of this just has to be kind of taken day by day?
And in Asia, we have learned that disaster may happen again. And we have seen in many countries in Asia, flood, tsunami, earthquake, typhoon. And this is something that we have seen over the years. And in many cases, when earthquake happens, we see millions of people lose their lives. When tsunami happens, we see lots of damage to the country. So this is not something that we don't know in Asia. We have seen that, we have experienced that, and we believe that this may happen in future. This time now was tsunami, was COVID-19, but tomorrow might be something else, as Gregoire said, malaria and other things. That's one. And the second point is that we have learned that media was not prepared, at least, to react quickly to coronavirus. Media was not prepared to react to disaster happening in different countries in the world, probably because this was worldwide and everybody was affected. But if you look at every single country, you can see that media were not very well prepared to react that. And for instance, you talked about MCO control, movement control order, and whether this has been useful or not. This has been useful, but more important than that is educating people to observe and to look at their health and to avoid getting infection in future. The other most important things that we learned is that public service media has to be strengthened. It was public service media who actually helped the situation, and we learned that the governments, policymakers, public should invest more on public service media. And this is the only way forward. Thank you.
You know, just very quickly as well, I'm wondering, because, you know, Asia was at the epicenter of several other threatening, what we thought could become pandemics, but didn't. We're looking at SARS, we're looking at MERS, and actually not MERS, but SARS was really the bigger one. Do you think there was maybe a sense of complacency when the novel coronavirus came to fruition in 2020, because we'd been there before with these other viruses that really amounted to very little?
Well, SARS was controlled because it was a will of politicians to control that at the beginning when it started. And of course, the disease and the virus was not as aggressive as COVID-19. But I do believe that in Asia, it could have been more actually preserved. It could have been dealt with more. And if you look at the countries who had experience in this case, actually you saw different policies taken by different countries. And that was because of the experience they had from previous disasters. For instance, as I said, Vietnam took immediate measure to close the border and look at the interest of the public. And one of my friends was in Hanoi for a business trip, and he said in March, way back in March, February, and he said that government is controlling everything. If you want to go to the lift, you have certain things not to touch by hand, the buttons and all that. So they started in February, and they resulted in good, saving people's life. So different countries reacted different, but generally, I can say we learned that although in Asia we have seen many disasters, but generally media was not as prepared as it should be, put it that way.
Okay, fair enough. Let me bring it back to Turkey. Ibrahim, Eren, we heard Javad saying, public service media really is key. It has to be maintained. Its voice is extremely important in times like this, in a pandemic. But having said that, we need to address the elephant in the room, and that is actually the presence of social media and what public broadcasters are up against, all broadcasters actually for that matter. A lot of people aren't paying as much attention to the news anymore as they are to their phones and what's going out on Twitter, Facebook, and other social media platforms. Ibrahim, speak to me about what the experience has been here in Turkey and what, public broadcasting, particularly TRT's news platforms, have had to go up against to try and keep information accurate and make sure that misinformation isn't spread out of control.
I think I have said before that the TV role of TV became again very important in those days, in the pandemic days, and the research continues. We made also field researches that the public service media is fulfilling the role of providing accurate and timely information for citizens. And in terms of ratings, we had one of the highest ratings we saw in TV, in news channel, in our pandemic days, because people were tuning more TV rather than online. People get information online, but trust and to check them if they are right, and to trust the news they read from their friends, from their WhatsApp messages or other social platforms. They tune on TV and they watch TV news very high in Turkey and at TRT. And I think that this is for the previous question about what we have learned, and this crisis comes with opportunities as well. Public service media, PCMs have great opportunities to strengthen their role, I think, and increase their share in those times. And one of the strengths we have is we can invest on very diversified content. And because in this time, in the lockouts, we see many people on TV screen rather than the same usual TV watchers. Like what I mean is, in the daytime, usually the women were on TV, but on the lockout, not just the women, but also men and the children were on TV as well. So the long tail products will be very important. And for the what we have learned question, if I can answer that question very briefly, I would like to answer that from a broader perspective. What I mean is, like, we learned as an institution that effectively working in some departments needs limited office hours rather than office hours. So some departments became more effective in their homes rather than at office. And e-learning and distance learning became the norm for this period. And as a public broadcaster, I think we need to invest more on e-learning and e-distance learning. And the consumption of media, the content has increased from video on demand services, from social platforms, and the base of consumption diversified. And what I think that some people think that the characteristics that may be defined as disadvantages for some is actually our biggest strength, public service biggest strength, which is we have limitations. Like all the content we produce, our content needs public service aspect in it. And I think it's a very big advantage for us, and we need to invest rather than there are too many content now. There's a let's say there's a mess of almost there's a content mess now. From VODs, different VODs, you pay for different services. And so as the PSMs are strength, so rather than I believe that the viewers, rather than struggling in trying to find right content from almost unlimited sources, audiences may leave themselves to the hands of trusted sources like the public service broadcasters. So as TRT, we have learned a lot from 2020, and inshallah, I believe that we don't learn much in 2021. But not just media, but a lot of sector have learned a lot, and the future of the media will, I think, dramatically change in the next coming years, as well as the PSMs.
Right. It's interesting, Ibrahim. I mean, we have experienced, not just as a result of the pandemic, but over the last 5 years in particular, a real overload of content, coming across so many platforms. But let me get the African perspective on that, actually, because there is a reality for many Africans, Gregoire, that they do find it easier to access smartphones, actually, and the technology and reception they get through smartphones and social media platforms than they do often to get access to television, particularly satellite television and news channels. So what are you up against as far as disseminating information through public broadcasting in Africa? What are you up against in social media platforms actually disseminating information accurately or inaccurately, but more quickly and sometimes more accessibly than you can as channels?
Thank you very much, Andrea. The situation in Africa is very specific. As you said, we have this social media, but when we look at it clearly, we see that the impact of social media in this fight against coronavirus was very, very destructive. I want to give an example. Now, if you come with a vaccine in Africa, if you want to make a campaign of vaccination, you must know that this will not work, because social media has already spread news that this vaccine is coming with a lot of bad things. They say that it will sterilize young people, it will sterilize young girls. Everywhere where you go now in Africa, they will tell you, we don't need vaccine, because they want to control the number of Africans. And some of these politicians made a lot of mistake when they started by saying that there are many Africans. Africa cannot develop itself if they don't control the rate of birth rate and so on. This brought a lot of problem in Africa. What I think, what we think as the union, yes, it's very difficult. The vaccine campaign in Africa will be very, very difficult if there is not, before that, a campaign to explain to people that what the social media said was very bad. I want to to quote an example. I have a friend who has a school in Yaoundé in Cameroon. And at the beginning of the school year, the medical doctor came only to see if the place was clean and all things. When the student and the teachers saw this medical doctor, all of them left the school, they ran out of the school, and they went in the village telling people that there is these people who want to bring vaccine are there. They want to come and sterilize us. It was terrible. The government was obliged to send military people to calm the country. Means that the effect of social media was very, very harmful in Africa. That's why I share the point of view of Dr. Javad and Noel and even Ibrahim, when they are raising the importance of public media, public service, because it is only with us that we can help the government to change the situation, because that is the biggest battle in Africa. That will be the biggest battle. How to explain to people that the vaccine which is coming is not there to sterilize people, but is to help people to face the COVID. And drawing the lesson
Gregoire,
after
the title
that.
of
Hello, I wanted to
I apologize. I mean, I
underline.
agree with you there. It's
Yes, I wanted to underline
Gregoire, yeah.
something. Yes, by saying that in Africa, the effect of prejudgments is very, very devastating. And these prejudgments are coming from African themselves, but also, and most of the time, from abroad. People who are looking at us. You cannot tell the history of Africa without knowing the realities of Africa. That we should stop that. We should stop that. When the Director General of World Health Organization, which is a moral person at that level, can go on the TV and say that it will be devastating in Africa because the hospitals are not good. People don't know how to wash their hands. People don't do this and do that. This is not the type of statement we need to help people in Africa to face this situation. So we believe as the union, and we think that the other sisters union should help us on that, is that we should increase and develop our capacities of productions. We have to tell our stories.
Okay.
We have to develop the way we present Africa, because the way people are looking Africa is always wrong. Always wrong. They don't take into consideration the realities of Africa. All is not bad in Africa. It's true. We have some government who are corrupt and so on, but there are people who are also fighting. I don't know if which are fighting.
Right.
So we believe that we must fight prejudgment. We must increase the level of production of African stories by African themselves, with the help of the sisters union. I quote sister union because I have confidence in sister unions. They are very. This is very, very interesting.
Okay,
I wanted
Gregoire,
to underline
you
that.
bring up a lot of very interesting. Yeah, you bring up a lot of very, very interesting issues, and one that I greatly appreciate is how you have an uphill battle going forward. We titled this panel here, how international media impacted the pandemic, but actually the impact still remains to be seen going forward. And you have said that if we don't really invest in good public broadcasting to get the message out on how to fight this pandemic via vaccines going forward, we actually could lose this battle even as a planet. The problem isn't just in Africa. Noel, Marcello, let me get to you. There's going to be a problem in Europe as well. We've seen plenty of anti-vaxxers come out and go against whatever science is out there and say, we're not going to be taking these vaccines. And if we don't get that critical mass of about 70%, we can't defeat this pandemic. So what is RAI going to do, for example, in a country as crucial as Italy going forward, to make sure that the messaging and the science is clear on what the vaccine could do, or how it can serve our population in overcoming the pandemic?
Well, first of all, we hope the science will be reliable enough to share good information, because what we have seen is that, for example, the competition among these big pharmaceutical groups saying one day we will cover our vaccine efficient of 90%, then the other day is 94, then the other day is 95. It's not serious. I mean, those kind of attitude spread not trust but mistrust, and therefore we hope that we can have reliable information at our disposal, because this is what our public need. They must be sure that what is going on is safe for their health. So what I feel is that the concern that the vaccine is being created too rapidly, it's not a fake news. It's a serious concern. So what we want to do is that to show that the vaccine are safe, because the authorities in Europe, in US, all over the world will tell us that they are safe 100% or 99%. And then this is what we need. And this is very complicated, because there are also, we know, commercial interests that push in one way or the other. And I guess that public service media should be seen by our public. This is our goal, not like a judge, but at least a source that you can rely on. And this is crucial for the next months, when we will speak a lot about vaccine.
Right. Noel, are you on the same page there? And I mean, how do you expect European public broadcasters in general to have to go up against, social media in this infodemic?
Yeah, like the vaccine battle is going to be huge. And, we've seen figures 40, 50% of people in some countries just say they will not take it. So I think I would totally agree with Marcello. Our responsibility is to impart accurate information, and to help the public understand accurate information. And we will need to see what information is coming out through the testing process, what is released on the safety. We will have to interrogate all of that, as we would with other initiatives. And I think that interrogation and that understanding and a range of voices is going to be really important for us. I also think we shouldn't patronize the anti-vaxxers. Some of them are we've seen from other things that they've written, they take a very extreme position on most issues. But an awful lot of people are just nervous. They're just kind of going, wait a minute, would I give this to my child? Would I take it myself? And I think we need to realize that for a lot of people, this isn't I'm just going to take the opposite view to everybody. It's all a conspiracy. They're just nervous. So again, that comes back to the reliability, the interrogation of the information that comes out on the safety, bringing forward voices. And then I think the range of voices, Andrea, becomes important, because sometimes on issues like vaccines, the range of voices for and against are not equal. You can have a vast majority of scientific opinion which agrees with a perspective. You can have a small minority that disagrees. And then we have to be careful that we don't get necessarily into a balance where we're giving every side 50-50, even if one side is an absolute minority opinion. So then you get into issues around impartiality, not balance. You get into those kinds of issues, which are going to be very complex for us. And then another issue we're going to have to deal with is emotion versus science. We interview someone on the street, and they get very emotional, and they say, I will not risk this. I will not take this risk. I will not do it. And then up pops some scientist who can't speak an ordinary language in terms of explaining it, and you lose everybody. So I just think those kinds of issues are going to be how we explain it, the kind of proportion we give, the questioning we do of the safety of any vaccine that comes out, the range of voices we hear, and not taking a side and being patronizing in any way with people who are against what may be a majority view. So I think that next year is going to be about the vaccine debate. The first 6 months of next year, we are still going to have COVID. We are still going to have deaths from COVID, and we will still have to cover that. But this vaccine debate and how we handle it, and we're already starting webinars, discussions amongst our members around sharing information, sharing knowledge and expertise and opinions around how we're going to cover that vaccine debate, because it's coming, and it's coming very soon.
Javad, are Asian broadcasters ready for that debate and for the emotion versus the science?
Vaccine campaign. It is much more in Africa, as Gregoire said, but we do have in Asia, if you look at the size of region and the size of population. And that's where the role of public service broadcasters comes in. I want to echo quickly what Ibrahim said on PSM and the public trust in PSM by giving you 2-3 examples. During the COVID-19, NHK Japan had close to 58% trust in public from the NHK. So in Japan, 58% public trusted NHK. In Australia, it was 70% trust in ABC television. In India, it was 82% people have tuned into the radio. So that means that people have trust in public service media. And if they have trust in public service media, it is the role of public service media to handle that challenge, to talk to the public and to overcome the emotion which social media may create by interviewing here, this and that. And I think that would be a big challenge for us, because in Europe it might be less than Asia because of the size of Asia, because of the literacy and illiteracy population, and the rural areas and villages, etc. It's not easy.
Okay, Javad, thank you for that. Let me wrap up then here in Turkey with Ibrahim Eren. Yeah, on the same issue. I mean, is it an uphill battle going forward now? Once the vaccine is hopefully in the next, coming months released to the public, what will Turkish broadcasters have to do to manage the information dealt to the Turkish public and to compete with social media and the voices of emotion that might not trust what scientists are saying? Ibrahim, if you cannot hear me, hopefully if you can respond to that.
Okay. I totally.
There you go. Yeah, go ahead.
Marcello, about the question, the vaccine, the concern of the public about the vaccine is a fair one and a legitimate one, because the vaccine is not tested yet. So, as Noel said, in the next coming year, the biggest debate will be about vaccine, and the science is not. The science has different opinions. We need to be balanced, rather, and as Noel said, it's very important that there is a mainstream science opinion, which the countries are taken for granted in their treatments, and public service media will balance this opinion with the other ones to make sure that the people, the audience, doesn't feel that there is no hidden secret behind vaccines. So we need to learn, by the way, as the journalists and broadcasters in the meantime, and that how the vaccines are working, what the percentage should be. So we will learn as well. So in the next coming year, I think the main thing is we need to be fairly open, and we need to have the courage to say that we do not know yet. So we need to share the public. We need to share the public the information that we have very openly and frankly, because it's a very serious health issue. And but it's the next year will be a very tough issue, I think, because not all the journalists are on the same page as well. It will be very tough for us when I think now the next coming year about the vaccines discussions.
It will be tough. I mean, we've heard, many doctors, scientists, and journalists saying the worst is actually yet to come. But we have gotten this far, and we are still keeping well and healthy. And I think international broadcasters, public broadcasters in particular, have done a stellar job of disseminating as much accurate information as possible. That is where we will now conclude this panel. I'd like to thank all 5 of my panelists so much for joining us. İbrahim Eren here in Turkey, Noel Curran, Director General of European Broadcasting Union, Javad Mottaghi there, representing the Secretary General of the Asia Pacific Broadcasting Union, Gregoire Ndjaka, CEO of Africa Union of Broadcasting, and of course, Marcello Foa, President of RAI, Italy's public broadcaster. Thanks all so much for being with us. I will end this panel now and hand it over to TRT World's host of Showcase, Elif Bereketli.